Travis Scott is one crazy tough dude. A few days ago at New York City's Rolling Loud Festival, he injured his knee while performing, thought that he had legitimately broken his knee, and then proceeded to continue the concert limping around on one leg for the rest of the show. We're now hearing reports that he dislocated his knee and is potentially going to have to undergo surgery. Welcome back, everybody. Now, typically on this channel, we're talking about injuries that happen to athletes, but what happened here with Travis Scott is something that we see pretty commonly in sports. And I never want to miss an opportunity to teach you guys something about the human body and about these types of injuries. So in this video, we're going to take a look at Travis Scott's knee injury and in particular talk about patellar dislocations. If you're a sports fan that wants to learn more about sports medicine and the injuries we read about in the news, then make sure and go subscribe. TMZ reported that he went to an orthopedic surgeon who is specifically a sports medicine specialist and found out that he had dislocated his knee. And that sounds crazy, right? That he would be able to continue performing after dislocating his knee. But as I'll talk about in this video, there's one little detail here that I think is missing that makes this less surprising of a feat. Looking at when this occurred here, Travis Scott's jumping up in the air, comes down to land on just his right foot and immediately collapses in pain. So first off, why am I not so overwhelmed when I hear that he had a knee dislocation but was able to keep performing? Our knee is actually composed of three separate joints. The main one we think about is the tibiofemoral joint between the tibia or the shin bone and the femur, which is your big thigh bone. But there's also a joint between the patella and the femur, as well as a joint between the tibia and the fibula. If Scott had actually dislocated his tibiofemoral joint, there, first of all, is no way he would have been able to perform. In order for this joint to get dislocated, you have to tear 3 of the 4 main ligaments supporting the knee. So between his ACL, his PCL, his MCL, and his LCL, he'd have to have torn 3 of these at least in order for that knee to be unstable and dislocated. With this degree of instability, you're not going to be able to keep doing your activities. And second, there's no way that avoiding surgery would even be an option. So what I suspect actually happened was he dislocated his patellofemoral joint, or the joint between his kneecap and his femur. Whenever you bend your knee, your patella slides in a groove of the femur called the trochlea. The muscles of the quadricep come down and form the quadriceps tendon, which insert onto the patella. And then further below that, you have the patellar tendon connecting into the tibia. Whenever your quad muscles are contracting to help extend your knee, there's a tendency for your patella to be pulled to the outside. To prevent the patella from slipping out and going outside of that groove, we have different structures on the inside of the kneecap that help keep it in place. The primary one we think about is something called the MPFL, or the medial patellofemoral ligament. This is a ligament that runs from the femur out to the patella, and it's oriented in such a way that it prevents the patella from moving out to the side or moving lateral. In the case of a patellar dislocation, this ligament gets torn and can pull away from the femur, allowing that kneecap to slip out of the groove and dislocate. Most of the time, patellar dislocations happen with high-level trauma, such as motor vehicle accidents or pretty severe falls. But they can also occur to athletes whenever they just land awkwardly with no direct contact whatsoever. The specific positioning when this occurs is usually when they land on a relatively straight leg, with the foot externally rotated, and then a bending moment gets applied to the knee. When you land in this position, sometimes that force can just be so overwhelming that it causes that MPFL ligament to completely tear away from the bone, which allows the kneecap to then slip out of the groove and dislocate. Looking back at when this happened to Travis Scott, we can see here he jumps up in the air, he comes down and lands on, again, a relatively straight leg. We can also see in this picture that it looks like his foot is externally rotated or pointed out away from his body a little bit. These are all factors that make someone at risk of dislocating their patella. Typically after this happens, the patella actually goes back in place on its own. So most likely, if this is what happened with Travis Scott, by the time he stood back up, his kneecap had probably snapped back into place, which is part of what allowed him to keep going. When you dislocate your kneecap, you're also at risk of having fractures to those bones. You typically have a really large joint effusion, meaning the joint fills up with fluid and gets really, really stiff and sore. Coming back now to the reporting that the doctors say he might not necessarily need surgery, but it sounds like Travis Scott wants to have surgery. An athlete who's simply dislocated their patella, but then it goes right back in place, can typically be managed without surgery. When this happens once, you're always at a much, much higher risk of it happening again. And so there's some instances where there's so much instability or it keeps happening over and over that people ultimately decide to have surgery to try to retighten those ligaments, providing that support. It can be controversial though, and there's not always a clear answer for what to do in these situations. Research has found that surgery helps provide more stability in the short term, But when you look down the road more long-term, there's really not much of a difference between people who had surgery and people who didn't. It's not surprising though, if this happened, that Scott would want to have surgery. It's a long rehab process to let those structures try to heal up on their own, and so you'd be absent from any like jumping activities like he's doing at his concerts, and playing sports like basketball. And also, if you don't have knee surgery, you're at a really high risk of having recurrent patellar dislocations. So did he dislocate his knee? Yeah, he probably did, but it was probably just a dislocation of his kneecap. If it had been his main knee joint, there A, is no way he would have been able to continue performing, and B, the option of not having surgery wouldn't have even been discussed. Other things to think about in this situation when they mention patellar tendon, yeah, he could have had some sort of injury to his patellar tendon, but this wouldn't be described as a knee dislocation. So we'll wait and see the final word here on what Scott ultimately has done, if he gets surgery or doesn't have surgery, and then if we get any more updates about exactly what happened and a specific diagnosis. I hope you guys learned something in this video. Again, make sure and go subscribe if you want to learn more about sports medicine and different sports injuries when they come up these upcoming seasons. But thank you for watching, and I'll see you in the next one. Bye.